Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before assisting with range of motion exercises, check the care plan or the nurse's instructions. Note any restrictions to the person's movement and any other special considerations. Range of motion safety measures. Cover the person with a bath blanket. Exercise only the joints the nurse tells you to exercise. Expose only the body part being exercised. Use good body mechanics. Support the part being exercised. Move the joint slowly, smoothly, and gently. Do not force the joint beyond present range of motion. Do not force the joint to point of pain. Ask the person if there is pain or discomfort. Repeat each movement 5 times or as stated in the care plan. It is important to know the major types of joints.
Pivotal joints allow for rotation and are located in the neck and forearms. Ball and socket joints are formed when the ball-shaped end of one bone fits into the cup-shaped socket of another. They are located in the shoulders and hips. Hinge joints allow movement like the hinge on a door. They are located in the knees, ankles, elbows, and fingers. Condyloid joints allow for flexion, extension, adduction, abduction, and circumduction. They are located in the wrists, fingers, and toes. Saddle joints permit flexion, extension, adduction, and abduction. They are located in the thumbs. Gliding joints permit only gliding movements and are located in the spine, hands, and toes.
Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Hi, I'm Betsy. I'm going to be your nursing assistant this morning. How are you today?
I'm fine, Betsy.
Good. I just want to verify your name and birthday. Can you verify that for me?
Yeah, Joseph O'Neill, March 27th, 1946.
All right, thanks. We're going to be doing your passive range of motion this morning, okay? So I'm going to go ahead and grab a bath blanket so that we can cover you, all right?
Before assisting with range of motion exercises, raise the bed to a level that provides for good body mechanics. If the bed rails are up, lower the one near you and place the person in the supine position. Cover him with the bath blanket and fan-fold the top linens to the foot of the bed. If allowed by your agency and instructed by the nurse, exercise the neck. To do this, place your hands over the person's ears to support his head. Also, support his jaw with your fingers. For flexion, bring the person's head forward until his chin touches his chest. For extension, straighten his head. For hyperextension, bring his head backward until his chin points up.
You doing okay?
Mm-hmm.
Good. Okay.
To perform rotation, turn his head from side to side. To perform lateral flexion, move his head to the right and to the left.
Okay.
You doing okay?
Yep.
Repeat flexion, extension, hyperextension, rotation, and lateral flexion 5 times or as directed by the care plan. To exercise the shoulder, grasp the person's wrist with one hand and his elbow with the other. Then perform flexion, raising his arms straight in front and over his head. Perform extension, bringing his arm down to his side.
If I'm hurting you at all, I'm just working on that shoulder range of motion.
If the person is sitting in a straight back chair or standing, perform hyperextension, moving his arm behind his body.
Okay, and now I'm going to be working on bringing your arm away from your body. Okay?
Okay.
Here we go.
Continue with abduction, moving the person's straight arm away from his side. Adduction, moving his straight arm to his side.
Any pain with that?
No.
Good. Now the last shoulder motion is going to be rotation. We're going to place your arm parallel with your shoulder, your elbow is bent, and we're going to do this motion 5 times as well. We're going to start with rotating down towards your stomach, and then up and back towards the pillow. Good.
Internal rotation, placing his bent elbow at shoulder level and moving his forearm down toward the body. And external rotation, moving his forearm toward the head. Repeat all of these shoulder exercises 5 times or as directed by the care plan.
All right, now I'm going to be moving on to your elbow.
Okay.
Okay, I'm going to put my hand under your elbow and right here at your wrist, and I'm going to be bending your hand up towards your shoulder. All right?
Okay.
We're going to be doing that 5 times.
Next, exercise the elbow. Grasping the person's wrist with one hand and his elbow with the other hand. For flexion, bend his arm so that it touches the shoulder on the same side. For extension, straighten his arm. Repeat flexion and extension 5 times, or the number of times stated on the care plan.
And now I'm just going to move down to your forearm. I'll keep my hand placement the same.
Okay.
Your palm is going to roll down and then up towards the ceiling.
To exercise the person's forearm, continue to support the wrist and elbow. Then perform pronation by turning his hand so the palm is down. Also perform supination by turning his hand so the palm is up. Repeat pronation and supination 5 times, or the number of times stated on the care
I'm going to do
plan.
the wrist. Just going to bend your elbow so it's a little more comfortable. And the first thing we're going to do is just move your hand down and then back.
Next, exercise the wrist. Holding it in both of your hands, begin with flexion, bending the person's hand down. Extension, straightening his hand. And hyperextension, bending his hand back.
All right, and the final motion with the wrist is I'm just going to be tilting your hand down towards me and then towards you.
Move on to radial flexion, turning the person's hand toward his thumb. And ulnar flexion, turning his hand toward his little finger. Repeat all of these wrist exercises 5 times or as directed by the care plan.
Still feeling okay?
Yeah.
We're going to start with your thumb. I'm going to be bringing your thumb out to the side and then back in.
To continue, exercise the thumb. Hold the person's hand with one hand and hold his thumb with your other hand. Then abduct his thumb, moving it out from the inner part of his index finger. And adduct his thumb, moving it back next to his index finger.
Now the next movement is going to be bringing your thumb over to touch your fingertips, and I'm going to be doing this movement, so you just try to keep your hand relaxed.
Also perform opposition, touching each fingertip with his thumb.
All right. Now I'm going to be bending your thumb. I'm going to be bending it down and then back.
Flexion, bending his thumb into his hand. And extension, moving his thumb out to the side of his fingers. Repeat the thumb exercises 5 times or as directed by the care plan.
I'm going to be moving on to your fingers. I'm going to be spreading your fingers apart and then together.
To complete the range of motion in the upper extremities, exercise the fingers. For abduction, spread the person's fingers and thumb apart. For adduction, bring his fingers and thumb together.
Move on here. All right, now I'm going to be bending your fingers, bending them down to your palm.
For flexion, make a fist. For extension, straighten his fingers so that they're straight along with his hand and arm. Repeat these exercises 5 times or as directed in the care plan.
All right, and we're going to start with hip bending.
Now turn your attention to the lower extremities. To exercise the hip, support the person's leg, placing one hand under his knee and the other under his ankle. For flexion, raise the person's leg. For extension, straighten his leg. For hyperextension, move his leg behind his body, if possible.
Okay, now I'm going to be bringing your leg out to the side.
To perform abduction, move the person's leg away from his body. To perform adduction, move it toward his other leg.
I'm going to set your leg down. We're going to do some rotation of the hip.
To perform internal rotation, turn his leg inward. To perform external rotation, turn it outward. Repeat each hip maneuver 5 times or as directed in the care plan.
All right, I'm going to do some range of motion of your knee.
Next, exercise the person's knee. To do this, support the joint with one hand under his knee and the other hand under his ankle. For flexion, bend his knee. For extension, straighten his knee. Repeat flexion and extension 5 times, or the number of times stated on the care plan.
I'm just going to go ahead and readjust the blanket. Cover up your leg a little bit more. Is that okay?
Okay.
All right. And now we're going to be working on just your foot moving towards your head. I'm going to cup your ankle with my hand and just bend up.
Now exercise the ankle while supporting the joint with one hand under the person's foot and the other hand under his ankle. To perform dorsiflexion, pull the foot forward as you push down on the heel. To perform plantar flexion, turn the foot down or point the toes. Repeat dorsiflexion and plantar flexion 5 times or as required by the care plan.
All right, now I'm just going to take my hand and move your foot side to side.
Move on by exercising the foot and continuing to support the person's foot and ankle. For this joint, use pronation, turning the outside of the person's foot up and the inside down. Also use supination, turning the inside of his foot up and the outside down. Repeat pronation and supination 5 times, or the number of times stated on the care plan.
All right, I'm going to do your toe motion. I'm going to push your toes down towards the bed.
To complete range of motion exercises for the lower extremities, exercise the person's toes. Begin with flexion, curling his toes, and extension, straightening his toes. Then perform abduction, spreading his toes, and adduction, putting his toes together. Repeat each toe exercise 5 times or as directed by the care plan. Now cover the person's leg and raise the bed rail if used. After completing range of motion exercises on this first side, go to the other side of the bed. If the bed rail near you is up, lower it. Then repeat all of the range of motion exercises on this side, from the shoulder down to the toes. After completing the range of motion exercises, perform post-procedure care. For example, remove the bath blanket and ensure the call light is within reach. For detailed information, see the section on follow-up care, reporting, and recording in the